Happy Friday. This is Dr. McDaniel. Today is Friday, April 26th. The Avengers movie comes out today. Going to see that on Sunday, so I'll give a quick review on that. Let's see. Today I'm going to speak about something completely unrelated to what I've been speaking about for the last 2 weeks, and that's going to be menopause. I get a lot of questions from patients about when they should expect menopause, what kind of symptoms are they going to have, what should they do to try and minimize those symptoms or to avoid them. So I'll do a brief overview and try to get more in depth with each aspect. First of all, most women will go through menopause around the same time as their mothers did. If you don't know when your mother went through menopause, but you have an older sister, then it's going to be around the time your older sister did. And that's because menopause has a genetic link. So most women will follow their mothers. The exception would be if you have some kind of medical condition that could increase the onset of menopause. A classic one is renal disease. So if you have kidney failure, more commonly than not, women with kidney failure will go through menopause sooner than they would have had they not had the problems with their kidneys. Sorry, having allergies today. On average, women will go through menopause as a general aspect somewhere between 52 and 54 years old is the average age for menopause. However, anyone who's 42 years and older is considered to be within a normal age range for menopause. Anyone who's under 42 years old who goes through menopause, that's abnormally young. So under 42 years old is considered premature ovarian failure or premature menopause. But 42 years and older is considered perfectly fine. Most women will have signs or symptoms of menopause for at least several months, up through several years before they go through menopause. I would say on average, most women will have symptoms between 1 to 2 years before they're actually menopausal. Now, the definition of menopause is a woman who has not had a menstrual cycle for on average 12 months straight and either has classic associated symptoms consistent with menopause and or has had her blood drawn to confirm that hormonally she is menopausal. That being said, women tend to follow their mothers or older siblings in terms of signs and symptoms of menopause. A symptom is something that a person feels or experiences themselves and expresses, whereas a sign is something that's objective. Anyone can look or observe and tell that you're menopausal or that you're going through menopause. So I would say in general, the major signs and symptoms of menopause are the same as premenstrual symptoms. So any symptoms that someone can experience up to 2 weeks before their menstrual cycle are usually the same symptoms they could have when they're going through menopause. And that's because it's due to similar scenarios. Premenstrual symptoms are due to high levels or relatively high levels or fluctuating hormonal levels, which induce hormonally related behavior or feelings, and menopause is the same story. So when someone goes through menopause, they have fluctuating levels of hormones, they have irregular ovulation patterns, and they have what would be considered premenstrual symptoms, but they're not just premenstrual, they're throughout the month. Classic premenstrual symptoms that are also what we call perimenopausal symptoms would be breast tenderness, bloating, appetite change, acne, headaches, especially frontal or occipital headaches, blurred vision for some women, but not very common, and it would depend on what kind of headaches and blurred vision they're having, fatigue, insomnia, nausea and vomiting for some women, emotional, irritable, angry, anxious, depressed, increased appetite or decreased appetite, lightheaded, dizzy spells, muscle aches, flu-like symptoms, and joint pain. And then the classic symptoms and signs are hot flushes, sweats throughout the day, or especially throughout the night, called night sweats appropriately, vaginal dryness and vaginal changes, and a change in sex drive or libido. All of those signs and symptoms can occur for a few months up to several years before someone is technically considered menopausal. And I forgot another one. That is a lot of women complain of dry skin and hair changes, drier hair or hair loss and dry skin. Those are two additional complaints. Let's see. As far as the symptoms go, most women, the most common of all of those symptoms will be the emotional, irritable, angry, depressed collection, and then hot flushes or sweats. Now, some women have lots of symptoms. They either have almost everything in the spectrum or they have a couple. And some women don't have any symptoms, just suddenly their cycle stops and they don't see it anymore. Most women will have irregular ovulation patterns, which will be evident because they have irregular cycle manifestations. So they'll have a cycle every 2 to 3 months, or they'll have a lighter, shorter cycle sometimes, what they consider their normal cycle other times, and that will wax and wane. Some women may go 3-4 months without a cycle and then have a 2-week cycle. Or they can have short cycles 3 weeks apart and then suddenly nothing for 6 months. But as previously stated, once that woman has reached the 12-month mark without a cycle, no spotting, no little pink spots, no brown smudgy, pasty, old blood look, which we call staining, nothing at all for 12 months, then the recommendation would be to draw her blood, a hormone panel. And that's because potentially she could be menopausal, which is a manifestation of anovulatory changes, but it could also potentially be due to a medical condition. So the hormone panel is always pituitary, brain, thyroid, ovarian hormones. Pituitary brain is prolactin level, because elevated prolactin levels can cause a cessation or stop in ovulation or an irregular ovulation pattern. Thyroid disorder can do the same, essentially if someone has hypothyroid or low thyroid levels. Occasionally if someone has hyper or increased thyroid levels, but those are more commonly associated with excessive menstrual cycles. And then obviously ovarian hormones, because the ovarian hormones dictate how the body responds to ovulation, so the menstrual pattern itself. If those bloods are menopausal, and that would be that the prolactin and the thyroid levels are normal, there's always a blood pregnancy test on that hormone panel. Very, very rarely is someone going to be pregnant. Maybe if someone's 41, 42 and you're concerned, might be a pregnancy. But if someone's 52, 53, they're not going to be pregnant. The ovarian hormones should consist of 3. The 2 hormones that we call them ovarian, but they're actually from the brain and they affect the ovaries. They dictate how the ovaries produce eggs. And then the 3rd one comes from the ovaries to increase the maturity and support of those eggs. So the first 2 are luteinizing hormone and follicle stimulating hormone, LH and FSH, and the latter is estradiol or estrogen. The first 2 should be elevated and the latter should be depressed or decreased. In that scenario, the first 2 should be on average greater than 15, and the last one should be very low, ideally less than 20, with the prolactin levels and the thyroid levels totally normal. If that's the case, in the face of no menses for 12 months, we say that person's menopausal. I will go into the details of the hormone panel and remedies for perimenopausal and menopausal symptoms on tomorrow's broadcast. I'm trying to keep these less than 10 minutes, so I'm exhibiting a lot of self-control. Thank you very much for watching. This is Dr. McDaniel in GYN Corner, and today has been a word on menopause, an introduction of sorts. I'll go into more detail tomorrow's presentation. That will be Saturday. Thank you and have a good night.